What does my thyroid cancer surgery pathology report mean? Imagine opening a detailed report after your thyroid surgery, full of medical terms that might seem confusing at first. This report is like a roadmap that helps your doctors understand what kind of thyroid cancer was present and how best to support your recovery. It's based on examining the tissue removed during your surgery under a microscope, giving precise details about the cancer's characteristics. The first important part of the report confirms the exact type of thyroid cancer you have. The main types are papillary, follicular, medullary, and anaplastic carcinoma. Knowing the type helps determine how aggressive the cancer might be and guides your treatment plan. The report also describes the size of the tumor and where it was located in your thyroid gland, usually in one of the two lobes. Larger tumors, or those in specific locations, can influence your staging and future treatment options. Next, the report discusses the tumor's grade and how much the cancer cells look like normal thyroid cells. Low-grade tumors tend to grow more slowly and are less likely to spread, while high-grade tumors look more abnormal and may be more aggressive. This information helps your medical team predict how the cancer might behave over time. Another key detail is the margin status. This tells whether cancer cells are present at the edge of the tissue that was removed. If the margins are negative, it means no cancer was found at the edges, suggesting all the visible cancer was likely removed. If margins are positive, some cancer cells are near or at the edge, which might mean some cancer remains. However, positive margins do not always mean the cancer will come back, especially if the tumor was small and contained. The report also looks at whether the tumor has spread beyond the thyroid capsule into surrounding tissues, called extrathyroidal extension. If the tumor has spread outside the thyroid, it can affect your staging and treatment decisions. Sometimes, the report notes if cancer cells are found in blood vessels or lymphatic channels, known as lymphovascular invasion, which can indicate a higher chance of spread. If lymph nodes were removed during surgery, the report will specify whether they contain cancer cells. Positive lymph nodes can influence your prognosis and whether additional treatments like radioactive iodine might be recommended. Sometimes, additional tests are done to look for specific genetic mutations or protein markers, such as BRAF mutations or calcitonin levels, which can help predict how the cancer might respond to certain therapies. Finally, the report may mention other findings like multiple tumor sites or changes in the thyroid tissue that could suggest hereditary conditions. All these details help your healthcare team tailor your follow-up care, which might include hormone therapy, imaging, or further surgery if needed. Understanding your pathology report is a vital step in your recovery journey. It helps your doctors assess the risk of recurrence, plan appropriate treatments, and guide symptom management. Remember, every case is unique, so always discuss your report thoroughly with your healthcare provider to understand what it means for your individual health and recovery.